It is from overnight. Police officers and outreach workers escorted homeless people who've been seeking shelter underground off the subways, encouraging them to relocate elsewhere. The interim president of the MTA telling Pix 11 this morning that they were offered to be taken to a shelter, also offered medical care and social services.
As we ask folks to leave the station because we're closing the system, we offer them social services. So if they'd like to go to a shelter, we take them to a shelter. If they need medical services, we take them to a hospital, an emergency room. We provide medical services. We have nurses there. We have social workers and outreach workers there to talk them through issues they may be having. And then we've got buses and commuter vans to take them to shelters if they take us up on that offer. So they could end up, and of course they could just decide that they want to go elsewhere on their own. So there are a variety of options for them.
All right, so joining us this morning is Giselle Ruthier from the Coalition for the Homeless. And Giselle, I understand there are reports that an estimated, 2,000 homeless people were forced off the subways last night. Was there an increase in calls to your hotline?
Well, we won't know so much about calls to our hotline today until later today, but we were out last night monitoring on the subways and really saw how horrific the situation was. I want to be really clear that no one was offered access to a private hotel room, which is the only safe option we have right now for people who are homeless. People are not accessing congregate shelters because they are currently not safe in this pandemic environment and the virus is spreading throughout them. So the vast majority of people we saw just went right up to the streets and were not brought inside safely.
I want to be clear with that because we're hearing from the interim MTA president that they were offered to be taken to a shelter, but you're saying that they are not safe. What proof do you have that they are not safe?
So congregate shelters are by nature congregate. So people can't practice social distancing in shelters. We have evidence from the Department of Homeless Services that over 800 people have tested positive for coronavirus across 170 shelters. The virus is present throughout the system. It has not been de-densified in a systematic way. There are 19,000 homeless adults in congregate shelters, and only a few thousand of them have been moved into hotels so far. So it's not an appropriate environment, and many people are rightfully choosing not to go into it. And what we need the city to do is offer people hotel rooms, which they are providing to other people who are not homeless, as well as homeless individuals in the shelter system.
Well, let me stop you right there because the mayor announced last week that they moved 6,000 homeless people into hotels. Your number is different. Tell me why.
So the last we know is that they've actually moved, as a result of the COVID crisis, about 3,000 people into hotel rooms. Another 3,500 people were already doubled up in hotel rooms prior to COVID because the city had used them for emergency shelter for several years. So I just want to be clear about what the response has been, particularly as a result of the virus, that's about 3,000 people just from the congregate shelters, and they have refused thus far to move to give people on the streets access to hotel rooms. So that's really key and important to remember as we're watching these videos.
Okay, so we'll have to be checking on that to see the validity of it because I'm hearing your side of it. I definitely want to check with the mayor's office to see if that's true. But at the same time, when it comes to moving folks off of the street into hotel rooms, is there some kind of a system where maybe women and children, families are getting some kind of preferential treatment?
So right now, what we actually need is for single adults who are in congregate shelters to be offered access to hotel rooms. That's because families right now are in the shelter system typically have their own unit. We do need some offer of isolation hotels for adult family members who have tested positive, who need to be isolated from their family to prevent spread within family. But right now, the urgency is among adults who are sleeping in dorms, sharing bathrooms, sharing dining facilities, and that's where we need the hotel rooms to be offered, particularly for folks on the streets.
So back to the subway system, what is being done on your end to help make sure that the homeless don't continue to try to get back on the subway system during this time?
Well, we want people to have a safe place to go. I mean, we are pushing the mayor and governor to actually offer people private hotel rooms so that they have a space to take the advice of public health officials, appropriately socially distance, take care of their basic needs. And right now they're not being offered that. And that is extremely upsetting. It is harmful to homeless people and harmful to the public at large, as we're not seeing the coronavirus crisis among homeless folks being handled appropriately. So that's what we're pushing for. And we're out on the streets handing out meals. We've set up a shower station for people, trying to get people's basic needs met. But we need the city and state to step up with the hotel rooms so that people have spaces to go.
And I imagine testing is a big part of the push as well. All right, thank you so much for your time. We appreciate the information. Of course, we're going to be talking about this in the days to come as the cleanings do continue. Thank you.
Thank you.